And we're now recording. So first of all, I just want to say welcome, everyone. We're so glad that so many of you are joining us tonight. For those of you who don't know me, my name is Kimberly Connell. I'm the Caregiver Services Specialist with Onondaga County Office for Aging. And the Caregiver Services through the Office for Aging offers these Institute for Caregiver classes free to caregivers or seniors or members in the community who would benefit every spring and every fall. And we have a number of caregiver training coming up in the next few months on Medicaid, legal issues and financial issues in caregiving, the positive approach to care for persons with dementia, healthy aging through activity and nutrition, and a number of other ones. So please stay tuned. I will definitely be able to send you information on them if you would like. Just let us know. But for tonight, we welcome you to Medicare for Me in 2023. This is indeed a really hot topic. So whether you're new to Medicare or interested in learning what's new in the coming year, or you've had Medicare for years and you still aren't sure what exactly Medicare covers, this class will help answer those questions so you can make the right decisions for yourself and your loved ones in 2023. And to present the class tonight, we have the expert. We're very pleased and privileged to have Taylor Kuzel, who is currently serving as the Services for the Aging Specialist at Onondaga County Office for Aging and Long-Term Care Services. Taylor successfully earned her master's in public health from Upstate Medical University with a dual certificate in health services management and policy through Syracuse University. In her current role with the county, Taylor oversees the Medicare counseling program, the senior shopping program, as well as the neighborhood advisor program. But in her day-to-day activities, Taylor provides Medicare eligible individuals with information and resources that they need to decipher what type of Medicare plan best suits them. Additionally, Taylor is a member of the Elder Justice Committee, the Elder Identity Theft Coalition, and she is a member of the Senior Advisory Council. Taylor's a strong advocate for the senior population and looks forward to continuing her efforts to support all seniors in our community. And so we are in very good hands indeed. Taylor, I welcome you. Thank you so very much for taking the time to do this. And you can go ahead and share your, Vicki just asked a question, can we record this? We're recording it. I'm not too sure that it can be recorded on your end. I'm not sure. But I guess if you have the capacity, I suppose so.
All right. Thanks, Kimberly. And thank you, everyone, for taking time out of your evenings to sit with me and go over Medicare information for the coming year. Again, my name is Taylor. I'm the aging specialist with the Office for Aging and the County Department of Adult and Long-Term Care Services. I will save time at the end of the program for us to go through questions. If there are questions that maybe warrant one-on-one follow-up, I'll definitely let you know that, and we can set up a time for any of us to chat one-on-one. Tonight we'll be talking about what is Medicare, the big question. What is this? We'll be looking at the differences between original Medicare versus Medicare Advantage plans. We'll be talking about those Medigap supplement plans, as well as what's new in 2023, what changes are coming, and how do I pick the right plan for me? How do I know that what I'm in or what I'm signing up for is going to work best for me? We'll be talking about different income-related savings programs that folks might be eligible for, as well as the New York State High Cap program, which is my role at the Office for Aging. So we'll be going through all of this today. And again, we'll do questions at the end, and don't feel shy to ask anything. So when we think about Medicare, I feel this picture summarizes most of the comments I get. Medicare can be overwhelming. It can be confusing. There's so many options, and there's so many choices that we can make or that we don't make. And that's what I'm here for, is to walk you through it. And if you've worked with me before, I know I see a few familiar faces and familiar names out in the crowd right now. I always say, let's take it one step at a time, and we'll take the time to go through it together. So you never have to, it's overwhelming at first, but I promise we'll help get you through it. The big question, what is Medicare? So Medicare is the federal health care insurance program. I always remember this by looking at that care portion. So Medicare is your health care insurance. Medicare is health care. And it's for individuals who are age 65 and older, legal or permanent US residents. It can be for individuals under the age of 65 who have been receiving Social Security disability for 24 months, individuals living with end-stage renal disease or ALS. Another common question I get is, which one of these cards is my Medicare card? How do I know if I have it? So I like to put the sample image in the bottom right corner of the Medicare insurance card. The Medicare insurance cards no longer have your Social Security information on there, and every person has their own special Medicare ID. On your red, white, and blue card, it'll show you what part of Medicare you have, if you have Part A, if you have Part B, if you have both, and when your coverage started. The next question I usually get is Medicare, Medicaid. I get the two confused, and the names are very similar to one another. The way I help myself remember it is, again, Medicare is your health care insurance, and Medicaid, it's that aid, it's your assistance. Medicaid is a state program, where Medicare comes down at the national level, it's federal. So Medicaid, it's state, it's aid, it's assistance. There's no income restrictions with Medicaid. It's based on low income and limited assets. And the coverage does vary state to state with Medicaid, whereas when you're looking at Medicare as a whole, it's all across the United States. And individuals will ask, can I have Medicare and Medicaid at the same time? Yes, you most certainly can, and many people do. And we'll definitely go through that as we go throughout the presentation. And if there's questions, of course, we can go over those at the end as well. Before I start taking a deeper dive, I want to just make sure we go over some of the key terms we'll be talking about. First is our premiums. Premiums are the monthly amount that you pay to have your insurance plan. It's your monthly fee. A deductible is the amount that you pay towards your plan before your insurance kicks in. So if you have a $100 deductible, you pay $100 towards your care, and then your insurance will kick in. Then there's coinsurances. A coinsurance is the portion of the cost of your service or the healthcare service you received that you pay. The most common example is with Medicare. Medicare normally pays 80%, and that 20% coinsurance gets billed to us. And then the last key term to go over is copays. Copayments are the set amount that you pay each time you go to a service. For example, most of us might have a copay when you go to a specialist. You go in, you check in, and the receptionist will say, okay, that's $25 or $40, however much it is. And that's the copay is what you pay up front or are billed following the service. Now we'll start looking at the different enrollment periods. So there's 4 key enrollment periods that we look at when we talk about Medicare. Of course, there's our initial enrollment period, which is the 7 months surrounding your birth month. There's fall open enrollment, which is going to be our main focus tonight. And fall open enrollment happens every year, October 15th to December 7th. And this is where you can join, switch, or change a plan that you're currently on, with coverage beginning on January 1st. The next is our general enrollment period, which is if you're on a Medicare Advantage plan, you can make changes to that from January 1st to March 31st. And then there's also special enrollment periods, which is when you're able to change the coverage you have if you've had what Medicare would consider a life-changing event. So losing a job, retiring, getting married, moving. But that's a program for another night. Tonight we'll be mainly focusing on fall open enrollment. I do know that there are some folks who are attending due to their initial enrollment, so I want to make sure we do put some focus on that as well. The initial enrollment period, it's the 7 months surrounding your birth month. And I'm a visual person, so I like to include little images in here. For example, looking at your initial enrollment period, if you're turning 65 in June, you look at the 3 months before your birth month and the 3 months after. And that's when you can enroll into Medicare surrounding your 65th birthday. And on the bottom, just outlines when your coverage would start. So if you signed up 3 months before your birth month, your coverage would begin on the first day of your birth month. And then thereafter, if your birthday's in June and you signed up in June, it would follow 1 month after, and so on. I don't want to spend too much time on this, but I do know, again, there are people in here who are going to be coming up on their initial enrollment period, and I'll be more than happy to take time one-on-one to go through that with folks, so we can make sure that we take it all step by step and focus on open enrollment for tonight. A lot of questions that I get at this time of year as well. Open enrollment for, of course, Medicare, open enrollment for employers, and a lot of folks start, thinking about retiring come the end of the year. So some individuals might have a special enrollment period, and a special enrollment period is when you are losing coverage from maybe a current job-based insurance or your spouse's job-based insurance. And this is when you can enroll into Medicare after being 65 without any late enrollment penalties. You can't overlap a special enrollment in the initial enrollment and open enrollment. There's all these steps in the process that we do have to go through. But again, I'm more than happy to help folks one-on-one so we can make sure that everyone gets the answer that is appropriate for their specific situation. And now, taking this deep dive into fall open enrollment. So fall open enrollment, again, every year, October 15th to December 7th. This is when you can make changes to your current coverage with Medicare. It's a good time to review your current coverage. And you should be looking in the mail for, it'll say an annual notice of change or an evidence of coverage if you're on an Advantage plan. And this is where you want to make note of and pay attention to, is there anything changing within your current Medicare Advantage plan, if that's the type of coverage you do have. And a fall open enrollment is really that time to look at your options and make sure that it fits your specific needs. Your health changes every year, my health changes every year, medications, doctors, these different insurance companies, they can stop accepting and paying for covering certain medications, or doctors' offices can stop accepting insurance plans. And you have to be notified of those things, but it's good to just check on what your coverage is or is not covering every year, and also looking at if it can save you money. When we're looking at our choices with Medicare, when we all are first enrolled, we all go for Medicare Part A, which is your hospital. We all go for the Medicare Part B. This is where our red, white, and blue card comes in. And then we start to look at our choices of original or traditional Medicare and those Medicare Advantage plans. Under original traditional Medicare, you have your Part A, you have your Part B, you have Part D. I always remember Part D is prescription drug coverage. And then we have the Medigap supplement plans. So you have to get a prescription plan. You have to do certain aspects of Medicare enrollment without getting a penalty, but Medigap supplement plans are optional. And we'll look into these supplement plans in a little bit. And then the next thing is Medicare Advantage plans. So you may have heard this called Medicare Part C. You either have original or advantage plans, or also known as Part C, but you'll never have original Medicare and advantage plans. So if you're ever thinking, or I know I get the question of, okay, I signed up for A, B, and D, now I need to pick up C. You'll never have D and C plans at the same time. When we're looking specifically at original Medicare, it's your Part A, hospital insurance. It's your Part B, medical insurance. And you join a separate Part D prescription drug plan. So original Medicare should be made up of Part A, Part B, and Part D as for prescription drugs. With original Medicare, because original Medicare is federal and it's run at the through Centers of Medicare and Medicaid Services, you're able to use any doctor or hospital across the U.S. that accepts Medicare. You generally don't need a referral to see specialists, and there's no yearly limit on out-of-pocket costs, which there are out-of-pocket cost limits with Advantage plans. Also, with original Medicare, you have the option to add on those Medigap supplement plans, which help pay the out-of-pocket costs. And as we referenced in the beginning, under the terms to know, the 20% coinsurance the Medicare doesn't cover. So I've mentioned Part A a few times here. What am I talking about? Part A, it's your hospital insurance, but I like to make sure that folks understand that it doesn't mean just going to the hospital, just being there. Part A hospital insurance only ever kicks in if somebody is inpatient in the hospital and the person has to be admitted into the hospital. A person can be in the hospital for 2 days in the ER or at the hospital under observation and still be that's considered outpatient. Until somebody is admitted into the hospital, until they are inpatient, then it wouldn't be covered. So Medicare Part A is only when somebody is inpatient. Part A will cover skilled nursing facility care for a short-term period of time after 3 days in the hospital. So Medicare will cover that short-term rehabilitation at a nursing home for up to 120 days. It doesn't cover full nursing home care, and it also doesn't cover a full home health care. It will cover skilled nursing facility for short-term rehab and home health care following an inpatient hospital stay for 3 days. Part B is your medical insurance. So that's everything outpatient. So again, someone can be at the hospital for 2 days there for observation. That would be outpatient. That would be billed to Medicare Part B. So that's everything. It's your primary care physician. It's going to the specialist, any doctors, preventative services, your shots, your vaccines, your yearly physical, screenings. It's physical or occupational therapy with, of course, have doctor referrals for making sure it's medically necessary. Part B will cover X-rays, labs, and ambulance services. A common question that I get from specifically veterans are, I have Part A, but I use the VA and I get all my medications, all my services are done at the VA. Should I pick up Medicare Part B? And I've discussed this with some of my coworkers in the Veterans Agency on our floor, and we always come to the conclusion that it is in someone's best interest as a veteran specifically to have Part B, even if they use the VA for everything, medical appointments, screenings, medications, because in a situation where somebody is unable to say, I use the VA. If someone's not able to verbalize to an EMT that they go to the VA, that they need to be taken to the VA and not St. Joe's, not to Crouse or Upstate, that person would be taken in an ambulance to a different hospital that's not the VA. And without Part B, there'd be $1,000 bill for ambulance services, and then whatever bill came out of that. So again, a lot of these situations can be individualized, and if it's something that you or someone is contemplating or has questions about, you can definitely refer them to myself or one of my volunteers or coworkers in the Veterans Agency, and just of course anyone that has Medicare questions in general. Looking at, okay, we have Part A, we have Part B, we have our red, white, and blue card. What does it cost? So Medicare Part A is free, premium free, if you have worked 10 years. They refer to it as 40 quarters. So if you have those 40 quarters of work history, then you receive Medicare Part A premium free. If you worked less than 10 years, you can pay up to about $500 a month, depending on how much work history credits you have. And then Medicare Part B, the standard premium for 2022 is $170.10. If you enroll late into Medicare Part B, there is a 10% penalty on that year's standard premium. And remember, you have those special enrollment periods. If you have coverage under an employer, don't worry. As long as you have other credible coverage, you won't get that 10% penalty fee. But again, feel free to always call me with questions, so we can chat about it one-on-one if you have questions or concerns. Some of the things that Medicare Part A and B don't cover are prescription medications or anything over the counter, no Tylenol, aspirin, vitamins, supplements. Medicare Part A and B don't cover long-term care, skilled nursing facilities, assisted living facilities. They only cover short-term rehab in those care settings after a hospital stay. Medicare Part A and B don't cover dental, vision, hearing. They don't cover cosmetic surgery, acupuncture, or routine foot care. Also under that original Medicare umbrella, so again, original Medicare, you have Part A, you have Part B, and then you pick up your prescription drug insurance. Part D prescription drug coverage is everything outpatient, meaning whatever you pick up at the pharmacy. So no medications that are administered at a doctor's office, that would be under your Part B. Part D is just everything that you get from the pharmacy, and so it's all your outpatient prescription drugs. You can get prescription drugs through, of course, a Part D plan. You can also get coverage through an Advantage plan. For the purpose of original Medicare, Part D is only prescription drugs. You should enroll to a Part D plan when you first pick up, when you're first enrolling into Medicare. Of course, there's different situations if you're still employed, but you should enroll when you're first signing up for, if you're signing up for Part B, you're likely needing Part D. If you are on Medicare and Medicaid, you're automatically enrolled into a plan that will offer you prescription drug plan. And Part D prescription plans cover some of the shots or vaccines that are not covered under Medicare Part B, such as shingles. When we're looking at what a Part D prescription drug plan should be covering, there's 6 different categories that a Part D prescription drug plan has to cover. All plans must include coverage of at least 2 medications from the following categories. For example, it must include coverage of at least 2 different types of HIV/AIDS medications, at least 2 antidepressants, 2 antipsychotics, 2 immunosuppressants, and so on. Certain medications, such as chemotherapy meds, those can be covered by a prescription drug plan unless administered at a doctor's office, which it would then be covered by Part B because it would be in an outpatient medical care setting. Continuing on with original Medicare. So to recap, original Medicare, you have Part A hospital, Part B medical, you pick up a Part D prescription drug plan, and then you have the option to add on the Medigap supplement insurance plans. Medigap supplement insurance plans only help cover items towards Part A and B. So it does not cover anything with prescription drugs. The Medigap can help pay the out-of-pocket costs not covered under original Medicare. So it's that 20%, the coinsurances, your copays, and deductibles. If you're wondering, well, how do I know what's a good Medigap supplement insurance for me? Call me, we'll go through it one-on-one. We get the books in the mail, Medicare for You. And that's the reason I changed the name of my presentation to Medicare for Me is because it's for me. It's not for you. It's not for us. It's Medicare for me. And I'll stress this so many times that when you're picking an insurance plan, it's what works best for you as an individual. So look, to find out what works best for you, I'm more than happy to sit down with anyone, talk over the phone, talk about what your situation is, so we can figure out, do I need a Medigap? Do I need what prescription drug plan? What do I do? I'm more than happy to go through that with folks. With those Medigap plans, you can use, because it's under the original Medicare, you can use Medigap anywhere in the United States that any doctor's office, hospital that accepts original Medicare. To get Medigap supplement insurance, you must have Medicare Part A and B because that's what it's helping to pay for. It's helping to pay for your Part A and B out-of-pocket costs not covered by your A and B. In New York State, we're lucky because we have continuous open enrollment into Medigap supplement plans, meaning that you can apply at any time of the year as long as you are already on original Medicare. In certain states, there are pre-existing condition wait periods of up to 6 months. In New York, the most you can have is 2 months at a time. And even with that, most of the time you can get that bypassed or essentially have your doctor override that. And but in New York State, companies are legally not able to deny you insurance coverage based off of a certain health condition. In looking at what the Medigap benefits are. There's 10 different plans, and they all cover the cost of Medicare Part A hospital coinsurances for the 365 lifetime days. They all cover Part B coinsurances. So that 20% coinsurance that is not covered by your Part B, if you get a $1,000 bill, Medicare will pay $800, you would be billed the $200 in remaining. And I did put together a chart that goes through the different plans, what each of the 10 different Medigap plans cover, how much they cost. So don't think that it's something that you need to go digging or searching for. I have it. We don't need to reinvent the wheel, and I'm more than happy to guide you through that. All of the Medigap plans cover the cost of blood and up to the first 3 pints of blood needed if someone is hospitalized and needs blood transfusions. And Medigap also covers hospice care coinsurance, and it covers the full cost of anything that was purchased after 2010. So now to flip to the other side of Medicare options. We went through original Medicare. You have your Part A, Part B, your Part D prescription drug, and the option to add on those Medigap supplement plans. So the other option is Medicare Advantage plans. This is also known as your Part C, as Part C as in cat. With the Medicare Advantage plans, they're private Medicare approved plans. So they have a set number of rules that they need to follow, a set number of policies they need to follow, provided by Medicare and the federal government. But they are private insurance companies. You'll hear Humana, United Healthcare, Aetna, Blue Cross. There's so many different options, which is why it can become overwhelming. With Advantage plans, you generally need referrals to see specialists. So you generally need to go to your primary care physician first, and they need to make a referral to a specialist if it's something that they feel is medically necessary. With Medicare Advantage plans, you generally need to use an in-network doctor, meaning that the doctor you go to needs to accept the insurance plan that you're on. Otherwise, you won't have coverage, or if you do have coverage, you're going to be paying a lot more. Medicare Advantage plans do have lower out-of-pocket costs and a yearly limit on those out-of-pocket costs, whereas original Medicare doesn't have those limits on out-of-pocket costs. Some Medicare Advantage plans offer additional benefits towards things like dental, vision, and hearing, which are not covered under your original Medicare option. And I also like to make sure folks know that not all Advantage plans offer prescription drug coverage. So it's something to be mindful of when looking at your options. If you're exploring the Medicare Advantage route, just know that, and make sure you're asking the right questions, and make sure it does offer prescription drug coverage as well. I get the question often of, okay, I picked up a Medicare Advantage plan. Now, can I pick up one of those Medigap supplement plans to cover any out-of-pocket costs? The answer is no. You cannot and you do not need Medigap plans with Medicare Advantage if you're going the Medicare Advantage plan route. So again, Medigap only goes under original Medicare with Part A, Part B, and Part D. And Advantage plans, if you pick up an Advantage plan, that's all you're picking up. So you'll just have the Part C. When looking at, no matter what type of Advantage plan or original Medicare or Medigap, no matter what you have, the question surrounding, does Medicare cover home health care? They only will cover it if somebody is homebound and if somebody needs skilled nursing services or therapy after a hospital stay and you need the doctor to confirm that and do that pre-authorization or the note of medical necessity in order to get that covered. You must receive care from a certified home health care agency in order to have your health insurance cover it. You might hear them referred to as CHAs. We do have another unit in our department called New York Connects. New York Connects is a great resource hub, and I know that they carry listings of the different certified home health care agencies, and I believe we have 5 of the certified home health care agencies in Onondaga County as well. So you can call myself or my coworkers in the New York Connects department to be able to get more information on where certified home health agencies are if somebody on Medicare is in need of that. If somebody is receiving Medicare and they need home care, it's important to know there are some things not covered with that, and that includes 24-hour care. It will not cover home delivered meals, so things like Meals on Wheels, it will not cover. No light housekeeping, laundry, cleaning, shopping, and no personal care. So no activities of daily living, specifically looking at bathing, toileting, and dressing. Some other items to keep an eye out in the mail for are Medicare summary notice. So a Medicare summary notice you can get year round. And the first thing I want you to know is it's not a bill. Medicare summary notices are not bills. It shows you what services you received within that quarter, that 3-month period, and what Medicare paid for those services during that 3-month period. The Medicare summary notice will allow you to see what you may owe, but it's not a bill. So don't worry at that point. You don't have to call Medicare to pay anything. It's just letting you know what Medicare for certain is covering. You'll get it every 3 months, only if you received a service or medical supplies during that 3-month period. If you didn't, then you won't get anything in the mail that month or that quarter. The next item to keep an eye out for is the Advanced Beneficiary Notice, also known as an ABN. This is what shows you the items that Medicare isn't expected to pay for. It will let you know why Medicare is most likely not going to pay for that service, and it will let you know the estimated cost of what you would pay if you are to move forward with the service without Medicare paying. Most of the time when Medicare or any health insurance is not covering an item, it's because the insurance company believes it's not medically necessary, and you have to have your doctor again do that pre-authorization or note of medical necessity to ensure that it's going to be covered. Now looking at, do I need to do anything during open enrollment? So no, you don't need to do anything. If you like your current plan, if there's no changes being made, and as long as that plan is going to be continued to be offered the following year, accepted at your pharmacy, accepted at your doctor's office. But I really like to encourage folks to consider comparing your options each year so that you know it's still the best plan for you. I know I've worked with individuals where, you sign up for Medicare and then, you have great coverage and there's no issues. But a couple years goes by and then you check into it and there ends up being options that can save you a minimum amount. It might not change at all, but I've worked with individuals that it's saved them thousands of dollars just by switching and just by looking into it. So don't feel shy. Reach out to me. It's what I'm here for. I love making sure that you're getting the best plans and best cost, best coverage that works for you. And I'll make sure to give my phone number and email in the chat after, so everyone can write it down. You can email me, we can set up phone appointments, in-person appointments, whatever works best for you. And if you don't switch your plan, if you don't do anything, if you don't make any changes, then that's okay. But just know that there's nothing that you need to do if you don't change your plan. You don't need to call someone, you don't need to call Medicare, you don't need to call your insurance company and say, I'm not switching, you don't need to renew, you don't need to recertify. Make sure that you are aware of the increase of scams this time of year with open enrollment. Never, be a savvy consumer. Don't give personal information over the phone, online. If you're not sure what a form is that you get in the mail, if you're not sure if a phone call is real, Medicare is never going to call you and ask for your social security, your credit card information. So you can always hang up, don't reply. You can call me, I'll help you look into it, and we'll figure out if it's something you need to take action on. So now looking at what is new to Medicare. So coming in 2023, Medicare will cover immunosuppressant medications for those with end-stage renal disease. If the person is not on Medicaid or other, employer insurance that would cover it. Medicare now covers everything COVID-19 related: vaccines, boosters, testing, treatment. If you or someone you know ever is told that they need to pay for any of those services, that make sure, have them follow up with me, have them follow up with their plan specifically. You don't need to pay anything COVID-19 related with Medicare. Medicare also now covers dementia and cognitive screenings. The mini cognitive assessment is included and is covered by your annual wellness visit, which is through your Medicare Part B. And it's the mini cognitive assessment. It's something that we should, definitely all look into doing. Our doctors are required to give this to us. It's covered by Medicare, and it's like getting your blood pressure checked. It's like getting that baseline, and it's covered by your Medicare Part B. So it's a good thing to know that it is covered, know that it's a service you are eligible to get at no additional cost to you. So don't feel shy to ask your doctor about that at your next wellness visit. Also in 2023, the Medicare Savings Program, which can help folks save towards Part A and B costs, the income limits are going to be increasing quite significantly for 2023, and I'll be able to make sure I share with Kimberly and all of my coworkers and individuals throughout the community what those limits are, so that so we know what we're eligible for. And if you're eligible for a program, I'll help you get connected with it, help you with applications, and make sure it's something that you're able to start receiving. So some cost changes coming in 2023. The Medicare Part A hospital deductible will be going from $1,556 to $1,600. Remember, your deductible is the amount that you pay towards the service before the plan kicks in. The Medicare Part B deductible is going down from $233 to $226, and that's a one-time payment. And the Medicare Part B standard premium is projected to go down about $5 for 2023. And this is due to, from 2021 to 2022, there was a large increase in the Part B premium due to the new Alzheimer's medication that was developed for treatment. Halfway through the year, they were able to figure out how to decrease the cost of production and administration of that medication. And instead of reimbursing folks and lowering the Part B premium in 2022, they're lowering it for 2023. So that is some good, exciting, positive changes coming in 23 for cost-wise. Also coming in 2023 for Medicare is the Inflation Reduction Act. The Inflation Reduction Act will see the following changes. There will be $0 cost sharings and no deductibles for your Part D vaccines. So specifically looking at shingles vaccines, I often get questions of, I had to pay X amount of money when going to get my shingles vaccine, and it's generally because that person didn't meet their Part D deductible yet. So that will be going away. There will now be limits on copays of $35 a month for Part D and B insulin products. So there will be limits on those insulin copays, and that is huge to see that capped at $35 a month. That's a great success for individuals and their loved ones living, that need to take insulin. Also, drug manufacturers are now going to be required to pay rebates to Medicare if they increase their medication prices and their drug prices through their pharmaceutical industry rate faster than the rate of inflation, which is also another big win for all of us in the Medicare world. If you're attending the program tonight because you are new to Medicare or you're going to be new to Medicare, to sign up, you go through Social Security Administration. If you're collecting Social Security, you'll be automatically enrolled into A and B. If you're not collecting Social Security, then that's when you'll look at that initial enrollment period, the 3 months before you turn 65, you can start enrolling. The only way, again, to enroll for Medicare Part A and B is online through ssa.gov. You can call Social Security at 800-772-1213. And they're also open for in-person appointments. The Syracuse office is downtown on Clinton Street. So you have a couple options. And if you have questions, if you know someone that has questions, you can have them call me. And looking at some different programs that can help us pay for these Medicare costs. Again, although some of the costs are going down for 2023, it's still a lot of money to afford every single month for many people. And the Medicare Savings Program, it is run at the local county level through everyone's Department of Social Services, and it can help for your Part A pay for Part B premiums as well as Part A premiums if it is someone that didn't have enough of those work history credits. If you're interested in being screened for that program and looking at the income limits, you can call me. I can help you do that screening process. The next is the New York State EPIC program, also known as the Elder Pharmaceutical Insurance Coverage. This is for individuals who have a Medicare prescription drug plan. It could be through Part D or Advantage plan, and it helps pay out-of-pocket costs not covered by your Part D or Advantage plan medications. EPIC, this is also income-based. For a single individual, the yearly income is $75,000 a year to be eligible. For a married couple who makes the yearly income limit is $100,000 or less. There's two different levels of the program based on your income that they'll be able to give you more guidance on. I have the directions on the applications. Any questions you have on EPIC in applying, again, 65 and older under those income limits, and you must be on a Medicare prescription drug plan. And then there's the Extra Help program through Social Security Administration. This is for individuals of any age on Medicare, and it's based on income and assets, and it can help you save up to $5,000 a year towards your prescription medications. So any of these programs, call me. We can go through a screening process. It won't take long for us to go through it. If you have 5 minutes in a day to call me, we'll go through it and if you're eligible, I'll mail you the applications. I can help you fill out applications over the phone as well if you want it, if that would be helpful. So now over the last hour, we've gone through over all this information. Where do I start? Where do I go? So really, first one, you're all here watching, you did this, so you're doing what you can to understand Medicare. What are my options? And then the next step is to find a plan that meets your current needs. And I stress your current needs. What works for you now won't necessarily work for you in 5 years. And what works for you or your spouse or your best friend or neighbor, we all have different needs. So really take that individualized approach to your health insurance. When you're getting a new plan, if you're signing up during open enrollment, know that your plan will begin January 1st. If you're just turning 65, if you're retiring, make sure you do ask and confirm when your new plan will begin. Call me about cost savings program, the HICAP program, health insurance counseling assistance program through the Office for Aging. It's a free service. I'm trained by New York State. I have 3 lovely volunteers that help me, especially during open enrollment period where things get a little bit more, a little busier, but call me. One of us will help you. There are tools online. If you go to Medicare.gov, Medicare.gov does have their own plan comparison tool that you could try at home, of course. And if you try it and have questions or want to confirm anything, I'll be happy to walk through it with you. But again, you can call me to just set up appointments and we can do it together over the phone, in person, video chat, whatever works best for you and whatever you're most comfortable with. So in looking at, if you're coming through me, the Office for Aging and the HICAP program, we can look at original Medicare versus Advantage plan, comparing the cost and coverage. I like to help folks just compare costs at different pharmacies as well. If you live by a Walgreens and Wegmans and Kinney's, I'm going to ask you those questions so that way we can see what covers your medications better than the other, and even the plans that you're on can be accepted better at one place over another. I'll go through income related savings programs with you all as needed and as requested, and just looking at what you're on, does it fit you, and are there better options that we can explore? And my main goal is to help folks make informed decisions, help make decisions that work best for your current life situation. So that is the end of my presentation. You can always call me at the Office for Aging, area code 315-435-2362. My direct extension is 4944. You can call me. If I don't answer, I'm likely on the other line with another individual, and I will get back to you, I promise. I get a little bit busier during open enrollment, but I always will get back to you and set up appointments. Sometimes we do them right on the spot if you have time, but just call me. Don't ever feel shy for that. And that is the end of my presentation. So now I'm ready for questions if there are any. And Kimberly, I'll hand it back over to you.
Oh, thank you. Thank you so much, Taylor. The one thing that I noticed throughout your presentation is about every 3 or 4 minutes you said, just call me, just call me.
Yep.
So, which is a wonderful thing. I mean, trust me, everyone who's on, Taylor is there for you. But God bless you for, the number of folks who are going to be calling, and you're going to be there and be patient with them. So there were a few questions. I had a quick question, if you don't mind, first. The ABN, the Advanced Beneficiary Notice you discussed.
Yes.
Are these sent when an uncovered procedure is requested, or is that something that you know ahead of time with your plan? What's covered and what's not, for instance?
So you should receive the Advanced Beneficiary Notice ahead of time, Keith. advanced, but that doesn't always happen. You should be informed ahead of time if a service is not going to be covered. This could be an ambulance ride, this can be an X-ray or a CT scan, anything. It should be given to you ahead of time so that you know that you are going to move forward getting a service that is not covered and you'll have to pay the out-of-pocket costs.
Okay. All right. That's really good to know. Okay. So Janet asked, no, this is a good question. Are premiums, are they priced per month or by the quarter? Because some folks I know told me last year, $170. Is that for 3 months or is that
No. So the premium, so the example, Medicare Part B premium of 170, that's every single month. When somebody is brand new to Medicare, you pay 3 months up front for, I'm not sure exactly why, but you pay 3 months up front for your Medicare when you first sign up. So you'll have to pay your 170.
Wow. Okay. So when when it's your birthday period, you have to pay three premiums altogether.
Yes, up front. So I know
Right.
folks will call me and they'll say, I have a $500 and something bill.
Wow.
Why? And I'll say, I'll ask the questions, are you new to Medicare? And did you just sign up? And you have to pay the first 3 months up front for some reason.
Okay. Wow. That's a lot. Okay. Thank you. And then Kevin asked, I think you answered this, Taylor. Can I get a Medigap plan at any time if I have an Advantage plan? And I think I heard you say you don't need it, but what if somebody wants it? Can they get off of their Advantage plan to get onto a Medigap plan at any time?
So no, you can't do that at any time. If you're on a Medicare Advantage plan, you can't pick up a Medigap plan. If you're on a Medicare Advantage plan and you want to switch to original Medicare during an enrollment period that allows you to do so, you can switch off of the Advantage plan, go to original Medicare, and then pick up a Medigap supplement plan. But you can't have Advantage and Medigap at the same time.
Okay. All right. I think that answered that question. So much of this, I have no idea too, so I'm learning a lot. And Ramani, I don't know if you can answer this. Well, let me ask Rebecca's questions first, which is, are the out-of-pocket limits that you were talking about for, different with different Advantage care plans?
Yes, they are. So
Okay.
they can range anywhere from $3,000 up to probably $13,000.
Oh, wow. Wow. Okay, so that would be one thing that an individual is going to want to consider when they're choosing
Yeah,
an Advantage care
absolutely.
plan.
Yep.
Something that they will ask you about. Okay.
Yep.
And then Ramani, I don't know if you can answer this, but if I choose to get Part A and I'm covered by my spouse's insurance, which one will pay for the hospitalization or inpatient admission?
So if you're on Part A, Medicare Part A is hospital. If you're on a spouse's or your own active employer, so if it's in an active employer insurance, whether it's yours or your spouse's, if it's an active employer insurance, then the active employer insurance pays first, and then Medicare becomes secondary. If someone is retired and it's retiree coverage, then Medicare would pay first. But while someone is actively working, the employer insurance pays first, and then Medicare pays secondary.
Okay, Ramani, does that make sense to you? I know.
Yes, thank you.
Okay, good.
Thank you. Yeah, when you say secondary, is it the deductibles and everything? I know that they won't pay right away, right? You have to meet the deductible. So
Yeah, that's a good question. So if when Medicare pays secondary, Medicare picks up whatever portion of the bill that yours or your spouse's active insurance didn't cover. So if your spouse's
Okay.
insurance or the active employer insurance, if that covered 80%, we'll stick with that number. It's been working tonight. If it covers 80%, that 20% would then be billed to Medicare. And then if for any reason there was something Medicare 2 was not covering, you would receive that remaining out-of-pocket costs, and you would, maybe have 20/50 a remaining bill, if that.
Yeah, that's good to know.
Then do we have to pay the 1,600,
Oh, the deductible would not be, no, that won't be because it's covered by the spouse's insurance, yeah.
Mhm.
Thank you, that's
Okay.
very helpful.
Thank you.
Thanks, Taylor. So, and Janet, it seems like the Advantage plans are more limited than original Medicare with out-of-network professionals. So is there any advantage to the Advantage care plans? I know that's a pretty broad question.
Yeah, no, it's a good question. It's a common question. So yes, Medicare Advantage plans are limited because of the in and out of network coverage. This could be a whole nother presentation, but Medicare Advantage plans also have, there's HMOs and there's PPOs. With the HMOs, you have the option, you only have the option of being in network. If it's not in network, you're not covered.
Oh,
Then there's the PPOs. PPOs give you in network and out of network. If it's out of network, you're still covered, just not as good. So looking at what are the advantages, so you pay less upfront. You're more likely to see $0 additional premiums. With the Advantage plans, you have the option to have coverage towards dental, vision, and hearing, where you don't have that with original Medicare. So I would say the biggest advantages that draw folks to it is the lower cost, and you can easily have more coverage towards dental, vision, and hearing instead of having to purchase a different standalone plan. And just I would say cost and the dental, vision, and hearing are probably the main factors, and there are limits on out-of-pocket costs as well.
okay. And Marianne says, are there many or any plans that pay for transportation?
Yeah, there are a few plans that will cover transportation, but again, most of these items, I'm probably reiterating some of these things too much, but the insurance companies want to see that it's medically necessary. They're not just going to give you somebody transportation to get their groceries just because. They will cover transportation to medical appointments after a hospital stay for physical therapy. There's certain criteria that has to be met, but there are some that will offer that transportation. But we also have transportation programs through the Office for Aging as well. So if it's not covered by your plan or someone's plan, call myself, call Kimberly, and we'll get you connected with our coworker that oversees that program too, just to explore all your options and just know what your choices are, from insurance to just other programs and services in the area.
Right. Yes, definitely give the Office for Aging a call. Our transportation coordinator is wonderful, Larry. So, I refer folks to him all the time.
Yeah.
There's lots of different options, so that's great. And Taylor, that's all the questions we had in the chat, but I had a quick question about Epic. Did you say that an individual financial eligibility is $75,000 a year? So if you make $75,000 a year or less, you would qualify for an Epic plan if you were an individual?
Yeah.
Well, that's tremendous. Wow.
You have to be 65 and older on a Medicare drug plan, and as a single individual, income less than $75,000 a year, married couples less than $100,000 a year. Yep.
Wow, that's quite high. So that's good to know.
Yeah.
Oh dear. Okay, so here's another from Denise. I'm confused, she says. You said Medicare is free to those who work 10 plus years, but then you mentioned the monthly premium. So is it truly free? That's the Advantage, I think, plan, but go ahead.
No, that's a great question. So Medicare Part A, your Medicare Part A hospital insurance is what folks are eligible to receive as premium free. So only Medicare Part A, your hospital can be premium free if you've worked the 10 years. Medicare Part B, you have to pay the Medicare Part B standard premium or higher, depending on your income. Or if you don't pay the Part B, it's because you have lower limited income receiving assistance through, Medicaid or the Medicare Savings Program.
Okay,
So Part A can be premium free. Part B generally is not unless you're qualifying for a savings program.
and so if you have original Medicare and not an Advantage Care plan, you're still paying that Medicare premium, right?
In general, yes.
Okay. Okay. I kind of get, I kind of get it too. It is confusing, so I'm glad you all are asking these questions. And Karen says, can you give us an idea of how much a Medigap plan might cost? I think there's a wide range, but
Yeah, it's a very wide range. I would say the average is probably 200 a month, an additional 200 a month, because you can get ones from, like $56 to be exact. Not that I look at these numbers a lot, but looking on average, it ranges from like 56 to almost, for higher mid 400s. So the average is about 200 a month. So you'll have your Part B premium plus a prescription drug plan premium, which range for 2023. Those will range from, if it's about $11 up to, I think, like $117. There's so many ranges. But like I said before, call me. I'll help you look at what works for you and give you cost estimates, cost comparisons, and coverage comparisons.
so, okay, I have a follow-up question. So the Medigap policy, you're going to pay anywhere from $56 to say $200 a month, but you're also going to be paying the Medicare premium plus a Medicare Part D premium?
Yes. Yeah. So, and the question, the question with that is, why am I going to spend 170 plus 200 plus a Part D premium, spending into, spending $400 a month in premiums for all my coverage? Why am I going to do that?
Yeah.
Folks do that. One, of course, you need to be able to afford that. But two, folks do that because you don't have out-of-pocket costs. You don't have surprise costs. It's that Medigap premium is helping pay for everything not covered by Part A and B. So, the way it just, if you do Medigap, you're doing that to eliminate this surprise cost of copays, coinsurance, and deductibles. You'll see more folks who are on, someone that's going through chemotherapy, dialysis, someone seeing specialists several times a month because, copays for a specialist on an Advantage plan, it could be 45. If you're doing a specialist all the time, it adds up. But like I said, call me and we'll talk through if it is a good option for you.
So it would be a good option, it sounds like, Taylor, if an individual is living with a life-limiting or chronic illness that their out-of-pocket costs are exceeding what those costs would be, or
Yes.
Okay, excellent. And then Romani, yes, that's right. So here's what Romani says. So we have to pay 170.11 plus 200 plus buy another plan for dental, vision, hearing for original Medicare per person.
So if you did that route, yes. But reminder, Medigap is not, you don't have to get a Medigap, that's optional.
Right.
If you did pick up a Medigap, you don't have to, but if you did, yes, you would be averaging about $400 a month in premiums. Yep.
Okay. But like you said, for some people, it makes financial sense.
Yes.
Depending on what their out-of-pocket costs are for their healthcare in general. Okay.
Correct.
All right. So Karen says, so Medigap would cover one when in the coverage gap, correct? I'm not sure what that means.
So you're not going to have coverage gaps and coverage phases under original Medicare like you do with Advantage plans. And you can't have Medigap and Advantage plans at the same time.
Right, and the coverage gap would be through okay, right. So basically with the Medigap, your costs are covered. You're paying a lot more monthly, but all your costs are covered. Okay.
Right. No, yeah, the way the way that I think of it is Medigap helps you eliminate surprise costs. It helps you eliminate the co-pays, co-insurance, and deductibles that you're seeing with your Medicare Parts A and B throughout the year.
Right, okay, good. I understand it. I hope you all do. That was very helpful, Taylor. Thank you so very much. Taylor, I just can't tell you how much I appreciate you and all the work that you do. I'm going to make sure when I send my follow-up email, I'll send a follow-up email out to everyone tomorrow. And included in that will be Taylor's information. I'm going to send the link to the survey that we would really appreciate it if you would complete.
Yes, thank
And also, you did mention the Medicare Savings Program eligibility. If you have that in the office, Taylor, and you provide that for me before I send out the follow-up email, I'll include that as well.
Oh, yeah, I can definitely get you that
Okay.
form.
So that would be helpful for people. And then expect your phone to ring, because I'm sure all these folks are going to call. So if there's no more questions, we're right at 6:45. So holy cow, we did good. Thank you, Ramani. It's good to see you. And I'm going to say good night to everyone. Thank Taylor once again. And wait for my email tomorrow. Thank you.
Okay.
They're sending you thanks, Taylor.
Thank you, everybody.
They all appreciate you. We all appreciate you. Okay.
Thanks for
All right.
having me.